in the last decade, what's happened is that there has been a growing concern about not just well-being in a physical sense, but also in a mental health setting for most people, right? Especially for those which are considered marginalized populations, right? Because we understand that the pressure or the mental health concerns are much larger. So when we talk about LGBTQI population, we're talking about 45 million people in our country. It's not, and this is, one of the approximate data. We don't know the actual data because we don't collect that in our census. So we're talking about a really large population, and we're talking about a population which is subjected to enough marginalization to make them a vulnerable population for mental health. For example, I was going over a couple of studies where there's research on, as large as 52% or 53% MSMs having psychiatric comorbidity. We know that suicide risk is higher, depressive symptoms are higher for LGBTQI population. So what's happened is over the last decade, there has been growing awareness and concern that there needs to be something that as mental health practitioners, as people of the community, as people responsible for each other, we need to do to look at what's happening within the community. And this becomes really important in the context of all health service providers because they become the primary space where somebody interacts first, right? So if we understand what is the sort of vulnerability that people are coming with, then we'd be looking out for some of these markers much faster and be catching them faster so that they can have access to treatment. Another thing that like I read when I was, making this presentation was that access to mental health services is very, very poor in our country, right? It's poor for everybody, but it's much worse for marginalized populations. So when we talk about, there was a study about MSMs in Ahmedabad, which is where they have that data of 52% could show positive psychiatric comorbidities. Not a single person had accessed mental health care services, which meant that that many people were living with psychiatric comorbidities without getting any relief, despite there being service providers, despite there being whatever minimal structures that exist in our current setup to provide these services. It's also known that there was another study which talks about trans star individuals accessing services, and majority people prefer to go to a private service provider rather than a government service provider. And that comes with a certain privilege, right? Like not everybody can afford private service providers. So that's in some ways an indication of what's really happening with the sort of services that we're providing and how safe individuals feel to access those services. So some of the things that that really deter people from being able to access mental health services, because that's a double stigmatized space, right? One is that you are considered a minority identity in certain sense. You're also accessing services for a mental health concern, which is a highly stigmatized concern in our country. So the extent of marginalization increases for such an individual. There's also inadequate knowledge in our um, training, to be honest. We're not taught enough to um, really be sensitive to the needs of all populations. We're not taught to look at mental health concerns as valid concerns. And that leads to a lot more discrimination than, say, in a physical health service space. Because it's considered that, I've had clients who've been told that, तुमने कुछ पाप किए हैं, because of which you're feeling this way. So of course you're feeling guilty. And all of that just like further stigmatizes the individual and doesn't let them come ahead and access um, mental health services. So it's been a really big social health issue that a lot of organizations have been taking up, where they talk about not just physical well-being but also psychological well-being of a community which is highly vulnerable to some of the psychological conditions.